प्रॉब्लम है उसमें लेकिन बॉडी तो ठीक है।
Welcome all of you. Again, thank you for joining. Today, there will be a very interesting and important topic as far as medical cannabis and cancer management is concerned. So, we are just starting session in a while. Just give us a minute. We'll be starting the session soon. And thank you for joining again. We are very much excited to have you today on this session. Just give us a second. Right. Thanks again, and let's start the talk today. So today there is a very important topic, by the way, and again we are thankful for Ananta Hempworks for ensuring these kind of sessions are happening at our platform. We have Vikram Bir Singh, co-founder of Ananta Hempworks, with us. Hi Vikram, how are you? You are on, I think, mute, so maybe you can unmute and share your inputs.
Yes, sorry. Thank you, Dr. Saab. I'm happy to be here.
Great. So again, thanks to all the doctors who have joined today. And today we'll be talking on the cancer management aspect. So there are several confusions and there are several, issues which we need to discuss today. So first of all, cannabis is helping in cancer management or no? Yes or no? The answer is yes. As far as worldwide researches are concerned, cannabis is very effective in cancer management in many aspects. We need to understand those aspects today. हमें ये समझना है कि कैंसर मैनेजमेंट में कैनबिस कहाँ-कहाँ कैसे-कैसे हेल्प करती है। थोड़ा सा उसके अंदर वी विल बी हैविंग दैट क्लैरिटी एंड वी गॉट दिस फीडबैक फ्रॉम द लास्ट सेशन। हमें फीडबैक मिला कि कुछ इंग्लिश और कुछ हिंदी में अगर हम वी कैन डू दीज सेशंस सो दैट विल बी बिकॉज़ वी हैव a strong like followers and strong like people who are from Hindi speaking areas and they want कि वही थोड़ा हिंदी में भी अगर इसको बताया जाए। सर्टेन पेशेंट्स हैं, आज का ये वीडियो आप अपने पेशेंट्स को भी दिखा सकते हैं। दे मे बी आर नॉट अवेयर अबाउट इंग्लिश लैंग्वेज वर्ड्स एंड ऑल, तो वो हिंदी में इसको समझ सकते हैं। So we will try to mix the languages today so that आप सब इसको like you will be able to understand. So now the point here is as far as cancer management is concerned, there are three dimensions. One is the side effect management, the issues which we are having either due to the cancer or the chemotherapy, radiation, and those aspects are there, right? Pain, acute pain is there, loss of appetite, weakness, many aspects are there for with a cancer patient. Second aspect is recurrence ko roke, like we reduce the recurrence, the chances of recurrence is reduced, or the existing cancer cells are converting into non-cancerous cells, that is getting decreased. We are reducing or delaying the metastasis. We are ensuring that cancer is not damaging us, or cancer due to cancer, if the death is there, like if it has been discussed that some person will not die, will not live, or maybe die within next 6 months or 1 year, that prolongation of years can be done or not. So all these questions are there, ये सारे questions हमारे पास आते हैं patients के, and we have to understand first of all the plant, the cannabis plant, and then we can discuss and then we can take it forward. As far as the cannabis plant is concerned, there are four aspects of this plant which we need to understand. as far as the cancer management is concerned, right? One is the flower and bud part. Two, I will say, flower and bud are two aspects which I will consider. Second or third is the leaves, and fourth is the hemp seeds part. So as far as the cancer management of like of the level of cancer control, or we are saying that cancer cells is getting converted into non-cancerous cell, yeah, cancer is getting reduced, or the spread is getting checked, the recurrence is getting checked or reduced. All those aspects can only be managed. I repeat, all those aspects can only be effectively managed with the medicines prepared by either flower or buds. That has to be very very clear, because the amount of cannabinoids, the potency of cannabinoids, the strength of cannabinoids, especially THC and many other active cannabinoids, are maximum available in flower and buds. So that's why, and it's not that we are saying this on this platform, or Ananta Hempworks is having any medicine or products. That's why me being the medical advisor of Ananta is saying this. No, this is being proven in the entire world. आप पूरे विश्व की रिसर्च स्टडीज उठा के देख लीजिए on cannabis, flower and bud, and it has been proven that this is very effective in converting cancerous cell into non-cancerous cell. अब आप बोलेंगे कि अगर आप ऐसा है तो फिर ये तो दुनिया जहान के तमाम कैंसर हॉस्पिटल्स में मिलनी चाहिए. Why not oncologists are prescribing this? Why not every doctor is prescribing if it is this much effective in cancer? So the answer is, see, there are so many dimensions and so many aspects where a particular medicine will reach into a particular system of medicine, and then doctors will start prescribing. First of all, this is a plant based medicine. This is a technically an Ayurveda medicine. It is not an allopathic medicine, so definitely certain set of allopathic practitioners will never prescribe this. But on the same note, several allopathic practitioners, oncologists around the world is advocating. Again, this is not I am saying. आप इसको देख सकते हैं, समझ सकते हैं, documentation है, documentaries हैं. We always say and we always advocate this. And I'm just typing one name of the documentary which I always request people to see. And आज कैंसर का सेशन है तो I will definitely promote this, because ये एक आई ओपनर है. जब मैंने इस डॉक्यूमेंट्री को देखा तो इससे आपको भी कैंसर के बारे में, कैसे कैनाबिस उसको इफेक्ट कर रहा है, कैसे कैनाबिस उसको फाइट कर रहा है, ये समझने में आपको फायदा मिलेगा. आप बीट द पीपल नेटफ्लिक्स आप स्क्रीन पे देख सकते हैं. दिस इज फ्लैशिंग द नेम. आप इसको सर्च कर सकते हैं नेटफ्लिक्स पे एंड यू विल गेट दिस डॉक्यूमेंट्री बीट द पीपल. एंड इसमें दिखाया गया है कि यूएस के कुछ बच्चे जो सेवरल टाइप ऑफ वेरियस टाइप ऑफ डिफरेंट टाइप ऑफ कैंसर से फाइट कर रहे थे, when cannabis has been introduced in their life by their parents को किसी से पता चला and they have started giving them the cannabis medicines. So within few months the reduction is very significant. The reduction is that much significant that allopathic doctors are surprised. They are saying on record that first time in life we have seen um, this much of reduction or this much of healing in these kind of cases. Several doctors on record are saying that we are leaving our conventional practice and we want to start medical cannabis practice as a medical cannabis practitioner. There was one video of a conference where so many allopathic doctors were there in a medical cannabis conference, and they want to grow as a medical cannabis practitioners rather than their own pathy. So that is the power and that is the potential of this herb which you need to understand, right? But again, as I said, we are not claiming anything in today's session. We are not here to convey this that this is the solution of cancer. This is being proven and this is being effective in so many cases around the world, and research is still going on. Research is still going on. People are doing more and more research, and all of you can contribute in those kind of research studies as well, right? So that is one thing, ये हमें समझना है. अब आ जाते हैं इंडिया के एस्पेक्ट में, इंडियन कॉन्टेक्स्ट में. So in India, till now, there is no single medicine being approved to be manufactured by using flower or bud as a raw material, right? So we only have either medicines prepared from the leaf extract or from the seeds and hemp seed oil, the food supplements and the nutritional products we have. So now with that, the limitation is we can't claim that this will convert cancerous cells into non-cancerous cells or this will reduce cancer in your body. But on the same note, the concentrated good quality leaf extract medicines are very effective in pain management, are very effective in certain kind of side effects, in improving quality of life, in giving them good sleep. And the main aspect cancer patients are suffering is the psychological imbalance, the mental health, that they are suffering from cancer. That is the biggest challenge with all of them. And many times we have seen that sometimes some cases they just need the willpower and the overall interest, that they are able to overcome the cancers. Sometimes some surgeries, small surgeries, they are fine. But many times we have seen that patients who are into mentally unstable conditions and they are not cope up with that thought that they are living with the cancer is killing them, right? So we need to understand that mental health is also very, very important. And cannabis medicines prepared from the leaf extract is an excellent solution for improving mental health. Insomnia, they are not able to sleep well, loss of appetite, their digestive system is impaired, they are having acute pain. In fact, I remember some of our cases. There was one cases, that lady around 52 years old, she was suffering from ca and ca breast, however, but the pain was very acute. She was taking highest level of opioid analgesics and certain other painkillers, still she was not able to get relief in the pain. And her son connected with us and we prescribed medical cannabis, they bought that. And from the single dose, I remember the call her son gave me, that thank you sir, first time I am seeing that my mother is without pain, and I'm very much thankful that you have prescribed medical cannabis. So the feeling and the satisfaction of relieving pain in someone's life is, I can't explain in words right now. And the pain these cancer patients are suffering is, we all can't imagine that. We can't imagine the pain they are suffering. The people who suffer from cancer, the amount of, the intensity, the gravity of pain, you can't imagine right now, which they suffer. And this is due to sometimes their cancer, it is due to sometimes the chemotherapy, radiations, or whatever the treatments they are going on. So pain management is a very effective solution which you can provide with the current medications we have in India, as far as the leaf extract medicines are concerned, right? So that way we need to understand. And to some extent I have seen with other Ayurveda medicine, it's not that in Ayurveda we don't have solutions. Again, we can't claim anything abruptly, but in Ayurveda many doctors are practicing and many doctors have that solution, that they are providing certain medicines which are proven effective. Hirak bhasam hum sab jante hain. So, and there are so many other medicines are there. So great. So already I think somebody has shared. So point is ki, we need to understand that these medicines which are available in India are very effective as far as uh, in terms of giving them the quality of life, in terms of managing their pain, managing their side effects of chemotherapy and radiation. So these, all these medicines we are abruptly, we are like very exhaustively using in our clinic. We are connected to several senior medical oncologists, surgical oncologists in our country, and we are getting very good feedback. In fact, they are referring to us as far as their patients are concerned. So I request all of you to get involved in this medical cannabis practice as soon as possible, and you can help so many patients in terms of relieving their pain, giving them better quality of life. That is very, very important. Second aspect is the nutrition aspect. So patients are always like required good quality nutrition when they are suffering from cancer. And again, hemp seeds and hemp seed oil are an excellent solution, specifically the omega 3, omega 6, omega 9, and concentrated form of nutrients, vitamins, minerals, and good level of protein help these patients in in many aspects, right? So that we need to understand, and accordingly we need to take it forward. So quickly I request Vikram to add some aspects as far as these nutritional aspects are concerned. And I think there is one product which you people are also planning to launch. So please let us know about that, and then I will add my inputs further. Thank you. Over to you, Vikram.
Thank you, Dr. Saab, and good afternoon to everybody who's joined us today. Thank you for taking up the time and attending the CME. As Dr. Saab mentioned, one of the main lines which we have is the nutritional line, which is made out of the hemp seeds. And there is a hemp seed oil, which we make out of that, which is a cold pressed hemp seed oil. And then we have hemp powder, which is the alternative protein intake from the hemp plant-based protein powder. And then we have a hemp heart, which is the dehulled hemp seeds. So going back to hemp seed oil, it's when there is a nutritional issue as far as cancer patients are concerned, Hemp seed oil is full of omegas and vitamins and magnesium, etc. The energy charge is so valuable because the omegas which we find in the hemp seed oil are in the ratio of 3:1, which is omega 6 is to 3, which is also called the golden ratio. Why it is called the golden ratio is because जब हम ये hemp seed oil consume करते हैं तो इस ratio में जब ये hemp seed oil के अंदर omegas पाए जाते हैं तो ह्यूमन बॉडी कंजम्पशन के लिए मैक्सिमम मतलब मोस्ट बेनिफिशियल होते हैं in the sense we are able to absorb maximum of it. And because omegas are also called the building blocks of the body, so except of providing nutrition, it also helps in restoring damaged cells, and it helps in a very holistic way. Similarly, the hemp hearts, if the requirement is of high fiber intake with protein intake, we can go for hemp hearts. And a hemp protein powder, yes, definitely, that is a majorly protein intake, and it is a very good option if somebody wants to shift over from a non-veg, basically a non-veg to a plant-based or a vegetarian diet, because it does not have any synthetic proteins. It is a plant-based protein alternative, and a lot of nutritionists and people who are into gymming and exercising, they are considering option against the synthetic protein option. So nutritionally, yes, all these products can help anyone, not just cancer patients who are looking for a nutritional value, or if somebody has a loss of appetite or anything, and when the right nutrition is not given to the body. So all these products can be used in a very very good way, in a healthy way, in an everyday lifestyle way. Coming to the medicine, as Dr. Saab explained, yes, all the medicines available in India right now are the leaf extract based medicines, in which the CBD, THC compounds and all the other cannabinoids compound is comparatively lower, not even comparatively, quite lower than the buds in the flower. But yes, the medicine made out of it can be used very nicely, and it can be used for pain treatment. It can be used for pain management. It can be used for in areas like chemo-induced nausea and pain. And we are supplying this medicine. I'll just like to show you the product. It's a raw extract. It looks like this, and it comes in a syringe format. This is an empty one right now, but it comes in this. It's a 5 ml syringe, and each ml of this extract almost has about 1000 mg of cannabinoids. So why we have taken out this product is because patients from MND background, patients from cancer background, especially terminally ill patients, palliative care patients, whose main aim is actually pain management and just improvement of their daily life, and they require a high dosage of cannabis to treat their pain. So this product is going to be very economical for them, and they can use it direct, and the efficacy and the bioavailability of the product will be much higher compared to if you start giving them the other cannabis medicines. First, it's not going to be cost from economic point of view, it's not going to be viable, and they'll have to consume too much of a quantity. So this extract is a very very raw extract is a very very good option for all this kind of cases. We are treating, in fact, I have a number of MND patients who are using my medicine, and now they want higher doses. So yes, this product will be available with us in the next 5 or 7 days, and they're waiting for this product that so I can send them. We have also engaged with a couple of cancer terminal patients who required this product immediately, which I had sent to them of some different company. But yes, this product works with pain management in a very very good way. So I'm hoping that this product will be sent to the patients, and we'll be able to help them with their pain management or any other issue. And yes, Dr. Saab mentioned about this series called Weed the People. I think every doctor should watch that, because in that series, actually, they've shown eradication of cancer through cannabis extract from the bud and the flower. And if we can learn something out of that, and we can propagate this, and tomorrow we the government allows us to go for a higher potency medicine. This is something which all of us should look into. That's it from my side right now. I'm Vikram, actually, one of the founders.
Great. Vikram, there are a couple of questions. One is,
Yes.
yeah, there are a couple of questions. One is, as far as this product which you have just informed to all, I think this is the concentrated form which you people are launching. So, what is the tentative cost you people are planning to launch this?
Okay. So, Doctor, it's not concentrated. Actually, it is the raw extract. So there is no.
Concentrated. I means that, see, generally the tinctures and the other things are getting diluted. Like you have not
Yes.
diluted that. Right? No? So
Yes.
concentrated, I mean that for example, we have this internal tincture, so that is getting diluted in the carrier oil, like the hemp seed
Yes.
oil or MCT oil and all. So,
Yes.
but this is particularly a concentrated extract in terms of concentration means this is only extract. You have not diluted anything in this, huh?
Yes, yes, we haven't diluted it. So,
Yeah.
Doctor, we are so as I explained, it's going to be a 5 ml packing. Each milliliter will have about 1,000 mgs of cannabinoids in it, and 5 ml syringe to the final customer. Right now, what we are placed it at 4,000 rupees. On the other scenario, if you're gonna go and
Only
try to get
4,000.
4,000,
I think that is a very good step you people have taken, because I remember that whatever the options available, because we recommend these kind of medicines as well, especially to the cancer patients. And I think again I need to congratulate. I'm not doing this because you people are doing platform, you're doing event on our platform, or like we are connected to them. But I think this is a very important aspect which you people have touched upon. The problem in India is still these kind of medicine, these kind of concentrated extracts in syringes forms are generally in the range of 8 to 10,000. So,
yes,
if you are able to launch in this range, I think this is a very crucial aspect which people are taking care of, because if we are able to reduce the cost at least to 50%, we can benefit so many patients and so many people who are suffering. So, I think that is very good effort you people are. I must congratulate all of you for this, because that is one thing. Second, I also need to understand, because see, generally doctors, as you people are also dealing, and this is a bit expensive product and a bit sensitive product as well. And generally, what we have seen in the form of tinctures or seeds, and also people are already doing sampling and providing samples to doctors. Whether for this product you will be able to have some kind of a sample for a doctor or not, that you need to clarify, please.
So yes, I'll answer both the questions. There is one more thing why we launched this product is because in the last 6 months when we started dealing with MND and cancer patients, we realized that for them to buy tinctures and other medicines are very very expensive. To reach 5,000 mg of cannabinoid, they have to take such a huge quantity. First, that's not comfortable. Second, the pocket does not allow you to do that. So this product actually, we have done after. It's not a product which we're going to be really marketing. It's not a product which we are really hoping to earn any profits from, because these patients which we are dealing with who actually require this medicine, they it's something which we want to help them with. So that is one reason why the costing is low. We could have placed it at a much higher cost. Secondly, sorry, second question was again, the second bit which you asked was
Sampling.
sampling. So Doctor, is to do sampling of this product right now, it is going to be very difficult because it's a raw extract. But if a doctor has number of patients, or he wants to test the product, I will definitely we will be able to do something about it personally, and provide them with a little bit of sample on some understanding in terms of, like, because it's a raw extract. So even if we give it out to a doctor, we just get some a declaration signed that okay, it's given to a doctor. So I do not think that if initially, even if I'll be able to provide the whole syringe as a sample to a doctor, but I will definitely help them out in getting some of that product in terms of for them to get confident and to use that. So if you ask me if I have a sample box of the extract, I don't right now. But it's a food for thought. Let me think about that, and probably of a 0.5 ml or a 1 ml sample, I think I should develop on this, and we'll definitely think about that.
Sure. Because see, actually, again, the problem we need to understand with medical cannabis practice is some doctors may not have experienced or practiced about these kind of medicines or extracts, because concentration is a bit high. So I think if we are able to, and I think we should do a separate session on this particular product, because the dimensions of dosing, the dimensions of using this product is very very different, and we need to
Definitely.
do an orientation around this, because this will be a very crucial aspect and a very crucial tool for all of us. So again, thanks for this kind of medicines, and with this cost, I think this is a very significant aspect. Just to discuss further, and I think we have some questions also from the doctors. By the way, any doctor who has joined first time, or if you are not although we know that maximum of you are still connected with Ananta, still if you are not connected, or you want samples, or you want to get them to you for whatever the support, they are open for growing all of you as far as the medical cannabis practitioners are concerned. So please do write to us. You can drop your email ID or mobile number here only. I'm just sharing our email ID, so you can email us as well after this. uh, like session, I request Vikram also to share their email ID and contact number as well, which you can flash on the screen. So anyone wants to connect with, because this is right now we are streaming on 8 platforms. We are live on LinkedIn, YouTube, Facebook, everywhere, Twitter and all. So anyone who is watching us from any platform, or maybe after this live session you will watch afterwards, so you can connect with us with the company directly, and we'll be able to help you in many aspects we can. So please let us know in that aspect as well. There are some more questions. Let me just take on that as well. Okay, so this one question is, no, we need not to see. The question is whether we need to stop the medicines they are taking for cancer, or it can be an addition. So as I said, in India, the medicines which are available are not that much potency as far as the flower and bud medicines are concerned. So we can't say right now. And in fact, in US also, they're not stopping anything. They're just adding whatever they are doing, and with that, people are seeing good response, and people are seeing expedite healing, which I will say, or quick healing in terms of the cancer cases are concerned. So whatever the standard of care is going on, along with that, you can continue with this. And at some point of time where if the remission is completely there, and it does not require that they need to continue with the standard of care, the treating doctor can do that. Till the time we have a full-fledged medical cannabis management protocol that standalone it can manage cancer, we have to do in addition. We have to do in whatever the standard of care is going on. To that, although there are debates, there are discussions that sometimes chemotherapy kills, cancer does not kill, or so on. So that is a separate discussion. We don't want to dilute that today. But the point is, we need to understand that whatever it's upon the patient. Sometimes I have seen some patients who have just taken Ayurveda and medical cannabis, and they are fine and they are healed in terms of their cancers are concerned. Again, we are not claiming anything here, but we need to understand the modalities, and we need to understand the dimensions. तो आप लोग please कोई भी मेडिसिन को मना मत करें, उनका जो भी ट्रीटमेंट चल रहा है उसको चलने दें, और उसके साथ आप मेडिकल कैनबिस को ऐड कर सकते हैं। इंडिया में जैसे मैंने बताया, प्रीडोमिनेंटली अभी हमारे पास यहाँ पर जितने भी डॉक्टर्स हैं जो इस सेशन को अटेंड कर रहे हैं, यू आर प्रीडोमिनेंटली फ्रॉम इंडियन एरियाज, इंडियन सिटीज। तो यहाँ पर जो मेडिसिन अवेलेबल हैं वो एडिशन के साथ आप दे सकते हैं। उससे यू कैन हैव बेटर पेन मैनेजमेंट, बेटर स्लीप क्वालिटी, बेटर मेंटल हेल्थ। उन सारे एस्पेक्ट्स में यू कैन टेक इट फॉरवर्ड। इसमें एक और एस्पेक्ट आया आता है दिमाग में, विच इज अबाउट द हैप्पीनेस। In studies, in research, it is proven that cannabis is a herb which increases your happiness index. अगर आप cannabis रेगुलर देते हैं पेशेंट्स को, तो वो जो उनका हैप्पीनेस इंडेक्स है वो भी इम्प्रूव होता है। मीन्स दे बिकम मोर एंड मोर हैप्पी, एंड that is very very crucial and very important when you are doing the cancer management. So that also need to understand. In fact, to the extent that it converts your negativity, it converts your negative dreams into positivity or positive dreams. That has also been proven in the research studies, right? Okay, so the next question is, what is the dosage? See, we have already done the dosage part. So Dr. Sharma is asking about the dose. So dosage we have already done. But my question, my request to you is, see, please go to that session. We are already having that session on YouTube. Right now, we need to understand for cannabis in cancer management, at least 1.5 mg to 2 mg per kg body weight should be the dosage in terms of if you want to calculate. So, for example, you are have a 50 kg person, so 50 mg can be the dose. Now with 50 mg you can calculate, like for example, Vikram, how much you mentioned in this paste you are launching with this extract form, how much is there in the total quantity and the mg? 5000 mg, right? In how much ml?
Yes,
5
it's,
ml?
it's yes, 5,000 mg and 5 ml. So that puts you at 1 ml at 1,000 mg. That's the
Right.
extract which we do in India.
And in 1 ml, how much drops we are expecting for this particular
So, Dr. Saab, is
paste?
in the particularly in this raw extract, you will not be able to go by drops because it's more like a waxy pasty thing. So you'll have to go by ml in this only, and the markers on the syringe will give you from a 0.25, 0.5, and then 1 ml. So generally, what I've seen in this extract, which is going to be used, are actually going to be used when a person is requiring more than 200, 300 mg of a
Right.
dose.
Right.
So it is, it is for that category. If you go at a 50 mg, 100 mg, then we have enough tinctures and we have enough capsules to take care of that. So raw
Sure.
extract will be for somebody who will require probably more than 200 mg of a dose a day.
Right. So in these cases, if somebody is having acute pain, then definitely you can go for higher dose, maybe 100, 150 or 200 also. And if
Yes.
people having acute side effects and acute issues, then definitely this much dose is fine. But with the mild to moderate cases, so the combination which we are practicing and which we are advising is to all the patient that at one time they can take the paste and the other time they can take the tincture, right? So or maybe you have tablets and capsules as well, right? So they can take once in a day they can take this paste, and other dosage, other time means, like for example you have three morning, lunch or dinner dosages. So in one time line you can have this paste, and the other two timelines you can have either tincture or capsule or tablet, and accordingly then you can manage the entire treatment protocol of that particular patient. So that kind of a loading dose you can, like, generally what we are doing is sometimes in the morning or sometimes in the night we are doing this paste thing with the existing patients with some other brands definitely. So and that is the loading dose, and with other medicines we are doing the maintenance dose. So that strategy you can use. But again, what we'll do is let's have a separate session when they will be ready and Ananta will be ready with this product to be launched and to be shipped to all of you. We'll do another session and then we'll be more discussing about the dosage and how you can add this to your existing medical cannabis and other Ayurveda treatments. Next question is from Dr. Prince, that is cannabis treatment can completely treat benign tumors. See, as far as tumor treatment is concerned, Dr. Prince, we need to understand that any kind of tumor, be it benign or malignant, uh, definitely there is an improvement. And cannabis is acting as a catalyst. So what we are doing is in our treatment protocols in Ayurveda, we all know about Kashna Guglu. There are double strength medicines. There are some other herbs like Varun and also along with that, when we are having cannabis in benign tumors, results are tremendous. And within few months, you can expect that the size is decreasing and the cases are getting improved. And for further discussion on case to case basis, we are always there and you can let us know. The next question is, if the patient is having third stage of cancer, does the medical cannabis works on it if we prescribe? So see, as far as third stage of cancer is concerned, Dr. Hamid, we need to understand that it is at a level which is a bit advanced. So medical cannabis will definitely work, as initially I said, but the medicines with having flower or bud, which is not readily available in India. So that we need to understand that work means decreasing the cancer, right? Decreasing the cancer cells. So that we need to understand. Is this recommended only for pain or treating cancer? Dr. Rekha is asking. So, as I said, Dr. Rekha, I think you joined a bit late. We have already covered this. Let me just quickly brief that for treatment of cancer, for treating cancer, at least medicines manufactured from the flower and bud should be there, because the high level of cannabinoids, the ratio, the potency is that much that they are capable of handling. We have seen in international scenarios, the cases are there where people are being treated and people are being healed with the cancers. We just discussed about one documentary as well, and you can just rewind the session and we already discussed on this. But yes, for pain, as Ananta team Vikram just introduced one product, and other tinctures and capsules are there. Everything is very effective in pain management, and you can always recommend that as well, along with the other medicines and other stand of care which they are going on. Great. So again, thank you all of you for joining today. It was a very nice, quick discussion with all of you. Please make aware. My request to all of you is, please make aware to more and more people who are suffering from cancer about medical cannabis. People who are traveling internationally or who have some international relatives. This is a very common thing that whenever somebody is hearing, ये बड़ा कॉमन सा एग्जांपल मैं आपको समझाता हूँ क्या हो रहा है। मैं मेरे को भी कुछ केसेस फैमिलीज, किसी भी फैमिली को पता चलता है कि एक कैंसर हो गया किसी को, पहला उनका, अगर कोई रिलेटिव या कोई फ्रेंड या कोई नोन बैठा है यूएस में, कनाडा में, यूरोप में, ऑस्ट्रेलिया में, कहीं पर भी, इजराइल, इटली, सो मेनी कंट्रीज वेयर कैनबिस इज सो मच पॉपुलर, उनका पहला वर्ड और पहला एक कमेंट होता है, आप इनको सीबीडी ऑयल स्टार्ट कर दीजिए साथ में। यहाँ पर तो सारे कैंसर स्पेशलिस्ट सीबीडी ऑयल या कैनाबिस बोलते हैं। ऐसे दीज फीडबैक्स आई एम गेटिंग फ्रॉम द पेशेंट्स, देयर रिलेटिव्स, देयर नोन फ्रेंड्स एंड ऑल फ्रॉम यूएस, कनाडा, कि यहाँ पर तो सारे कैनाबिस को बोलते हैं, सारे ऑन्कोलॉजिस्ट, सारे कैंसर के डॉक्टर्स बोलते हैं कि साथ में सीबीडी ऑयल दे दीजिए, कैनाबिस दे दीजिए, मेडिकल कैनाबिस यू शुड स्टार्ट with whatever the stand of care you are giving. Everybody is saying that, and everybody is sometimes doctors are advocating, sometimes they're not advocating, but they're not denying. वो कई बार बोलते हैं कि हम जाके पूछते हैं, हम बोलते हैं हाँ दे सकते हैं, कोई प्रॉब्लम नहीं है. So my point is, if the world's top cancer doctors, world's top oncologists, चाहे आप यूएस की बात करें, कनाडा की, दे आर रिकमेंडिंग, व्हाई नॉट वी आर मेकिंग अवेयर टू ऑल द पेशेंट्स हु आर सफरिंग फ्रॉम कैंसर. And I request to all the allopathic doctors also, to all the oncologists also who are watching this session in India, please make your patients aware. We are there to help you out. We are there to support you in medical cannabis treatment. So I request, please, we again have to work as a team, as an integrated model. We respect the knowledge, the experience, the advancement you people have in your system of medicine. But on the same note, medical cannabis is a very crucial and very important domain which we can't neglect now. And we should refer and we should recommend more and more patients to be included in this, along with whatever the standoff care they are taking, to reduce their pain, to reduce their sufferings, to improve their quality of life. So that, I think, is the goal of each and every doctor for healing the patients. On that note, I request all of you to please make everyone aware about this. And thank you, Vikram, for joining again in today's session. Looking forward for another session. Thank you.
Thank you, Dr. Saab. Thank you for all the effort. Always a pleasure talking to you about this. And thank you to everybody who's listening to us and taking out the time to listen to us. We hope that we were able to bring in some information to the ground. And anybody, please, I've already shared my email. Anybody wanting to connect for any information on the products, please connect with me at vikram@hempworks.com, and we'll be happy to assist you and guide you or give you any information regarding the products or medical cannabis. Thank you once again, Dr. Sab. We'll see you next Thursday.
Sure. Thank you.
Thank you.